The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hi, everybody. Welcome to the next episode of TMD Demystified. I am Tony Urbanic. Today's program, I hope you will find very interesting. I am definitely going to find it very interesting to give it to you. Something very relatively unusual, although I've spoken on it before, somewhat in a more general way. Today, we're going to break down the relationship between inflammation within the temporomandibular joint and arm, hand, and finger tingling, numbness, burning, and pain. I have mentioned so many times that one of the symptoms associated with temporomandibular joint disorder, to remind you, it is one disorder. It has multiple symptoms. It has many disparate symptoms. And one of those disparate symptoms is arm, hand, finger tingling and numbness, burning, and pain. But it is one disease, which is chronic inflammation within the temporomandibular joint. So TMD is a single disease, best defined as chronic inflammation within the temporomandibular joint, and not defined as each and every one of the symptoms, and trying to treat each and every one of those symptoms as a separate disease, for sure. And that is what the standard protocol is out there in 2026 right now, is trying to treat each and every one of these symptoms as a separate disease, which in my mind is foolish. But today's title is Arm, Hand, Finger Tingling and Numbness and TMD. Now, how I came across this is very interesting. How I came across this symptom, one of the disparate symptoms of TMD, arm, hand, finger tingling and numbness, because my patients brought it to my attention. I have learned most about this problem, TMD, looking back over my last 50-year career, the first 36 of it doing surgeries on the temporomandibular joint, and the last 15 to 16 doing non-surgical treatment to the temporomandibular joint. But I have learned most about this disease by listening to my patients. I have spoken many times about how I got on the right track. The patients led me to the right solution by telling me, when I interviewed patients, without telling them what kind of surgery I wanted to do for them, I just asked them what they think about it, what makes it better, makes it worse, and they would say, if I take a pencil eraser and put it between my front teeth or my finger or a piece of cloth and gently bite down, it makes the symptoms feel better. And that is how the Urbanic device and protocol got started. I did the research. What in the heck does putting something between your front teeth have to do with decreasing the symptoms of TMD? That's a different story. But today we're going to talk about just one symptom, arm, hand, finger tingling and numbness. And again, by listening to my patients, they brought me in the right direction. They pointed me where to look. And I looked there and I went, oh my God. This is obvious. This is obvious. The solution to TMD is obvious. Rest the joint enough to make the inflammation go away. How do you rest the joint? You do it with a very simple device which unloads the posterior teeth, where 90% of the loads on the joint are generated. Posterior occlusion generates 90% of the loads on the temporomandibular joint. Unload the posterior teeth according to a protocol carefully, inflammation goes away and all the symptoms go away, because the discovery was all of the symptoms are created by chronic inflammation within the temporomandibular joint. All right, as a primer, as a forward in the discussion for today, let me just say that my patients, again, brought me to exactly where I needed to look because I listened to my patients. So years ago, I mean, it was at least 10 years ago, I was discussing with one of my patients how the symptoms were going after 2 months of using this device and protocol. And her comment was, and I remember it very well, she said, "Thanks, doc." She says, "My headaches and my earaches and my neck pain are gone. But does this have anything to do with my arm, hand, and finger tingling and numbness? Because it went away also." And I went, "I never heard of that before. You got me. Never heard of that." And I said, "I can't take credit for that. I don't want to take credit for it. But I'm glad it went away." But what she was happy about was that her headache and earache and neck pain had gone away. And I filed that comment away someplace out there in my mental gymnastic brain. And about 2 months later, another patient came in and basically said the same thing, made the same comment, that some tingling that she had in her fingers had decreased when her headaches went away using the urbanic device and protocol. And I filed it away, but I didn't think much of it. And then about 6 months later, a third patient came in and made a similar comment. At that point, I went back to the basics, the basic sciences. Basically, in this case, the basic science would be anatomy, physiology, of the nerves and the muscles. And I pulled out my Gray's Anatomy, which was my Gray's Anatomy is a 1954 edition, which was gifted to me by the chairman of the Department of Anatomy at Indiana University when he found out that I couldn't afford a Gray's Anatomy when I started my program in cell biology and anatomy. After I finished 3 years of dental school, I got a degree in cell biology and anatomy, and he found out he wanted to point me to Gray's Anatomy and discuss something, and I said, "Sir, I don't have a Gray's Anatomy." And he said, "Why not?" I said, "I can't afford one." And he literally pulled out his Gray's that he used in medical school, 1954 edition, and said, "You take this, you take mine." And he gave me, and I still have it and I still use it. So I pulled out Gray's Anatomy and I began looking at the structures of the arm, hand, finger tingling, and numbness, and traced that back, which is common knowledge, to the brachial plexus, which is a plexus of nerves that comes out of the spinal cord, the cervical spinal cord, and I think T1, 3, 4, 5, and C3, 4, 5, and T1, and creates the brachial plexus. And I take that back. Looking at C5, C6, C7, C8, and T1, creates the brachial plexus. And the brachial plexus, as it turns out, comes out of the neck between two major strap muscles. They're called scalene muscles. The scalene muscles, the anterior and middle primarily, and between the anterior and middle large strap muscles, they're like two large straps that hold the neck erect primarily and move it around somewhat. And between those two muscles come the brachial plexus, which all are the nerves that innervate the arm, forearm, wrist, and fingers. And it became obvious to me that when the neck gets those sympathetic signals, nervous signals, to tighten up the neck, when tightening up just the jaw doesn't rest the joint enough, the sympathetic signals coming from the brain stem say, all right, I told you tighten the jaw, but you're still giving me signals that the joint's inflamed. So now I want you to tighten up the whole head, hold the whole head tight, which signals these scalene muscles and other muscles of the neck to tighten up. But between the scalene muscles come the brachial plexus. And on some patients, not every patient, in fact, I would guess it's no more than somewhere between 10 and 15%, maybe 20%, somewhere around 10%, excuse me, of patients exhibit some form or history of arm, hand, finger tingling and numbness associated with TMD. It's not the majority. So and again, anatomy varies between patients, the anatomy of the muscles, the position of the brachial plexus, and all kind of things can change. But it is a well-known now, consistent symptom of TMD is arm, hand, finger tingling and numbness. And when those muscles tighten up, they squeeze the brachial plexus, which creates the symptoms. So actually, I then, when I investigated that, and this was years ago, this is at least 10 years ago, then I began adding that question to my symptom list. As I ran through a consultation with a patient, the first thing I want to do is discover what symptoms the patient has, what they present with that may be symptoms of TMD. And as I've reeled off many, many, many times, the common, well-accepted, well-agreed upon symptoms of TMD are frequent and or recurring. Frequent and or recurring, doesn't have to be frequent, but they definitely will be recurring. Headache, earache, jaw pain, neck pain, ringing in the ears, tinnitus, subjective hearing loss, which is that fullness in the ear, like you can't hear, you got water in your ear, dizziness/vertigo, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, which we're talking about now, and then various kinds of locking. Those are the primary. There are some secondaries. I am investigating visual disturbances at the present time, which are consistent, again, with signals of the sympathetic system into the muscles that move the eye. But we won't go in that direction today. We're talking about arm, hand, finger tingling and numbness. So I have placed that symptom on my symptom list, and many, many patients say, yeah, I thought I had carpal tunnel symptom. I've had a couple patients who have actually had carpal tunnel surgery thinking it was carpal tunnel, which did not solve the symptoms, because there is an entity of carpal tunnel syndrome, which is solved by a little bit of surgery by the orthopedic surgeons. But I've had a couple of patients who have had that surgery and not solved the problem of the numbness and tingling, which did go away when inflammation within the temporomandibular joint decreased. That doesn't prove it, but it leads you in the right direction. And to do a study that can be done, I haven't had the time to do that study yet. Maybe someday I will. Maybe someday I'll hire somebody to do that study. But the point is that arm, hand, finger tingling and numbness can definitely be generated by the squeezing of the anterior and middle strap muscles, scalene muscles, squeezing the brachial plexus, creating that disease. So what I did was I asked AI recently about this, and I asked AI if I've given my AI a name, which is Rene, R-E-N-E. I'll leave you to determine why I might call him Rene. But he provided me with a diagram, which I'm going to share with you now. So I hope you can read this. If not, I'll talk about it a little bit. But basically, here's how the sympathetic activity can cause brachial plexus compression at the scalene muscles, creating the symptoms of arm, hand, finger tingling, and numbness. First of all, chronic inflammation within the temporomandibular joint, which we've talked about so many times, it needs to be chronic inflammation. In the initial stages of damage to the temporomandibular joint, you get kind of regular inflammation. And regular inflammation is a different set of cell and cell exudates than the chronic inflammation. Chronic inflammation has more exudates that are more destructive than the initial initial inflammation. Initial inflammation is more set up to heal an area initially. But if the healing does not go on, if the healing non-healing goes on long enough, those cellular types within an area, any area, but in this case we're talking about the TMJ, converts to chronic inflammation, and the cellular exudates can be very destructive and cause bone loss and cartilage loss, and create symptoms of pain and stimulate the autonomic nervous system, sympathetic portion. So chronic inflammation of the temporomandibular joint stimulates the trigeminal nociceptors. I'm reading now step one. Now that's step one. Step two, trigeminal signals to the brainstem. The nociceptors input travel via the trigeminal nerve to the spinal trigeminal nucleus, both of those being in the brainstem. Then to the brainstem reticular formation. Once there, the brainstem activates the sympathetic outflow or output. Reticular formation activates the sympathetic nervous system to increase muscle tone and stabilize the head and neck. Again, this is the mechanism within the body. It's an amazing mechanism we have. The body, inflammation, and the immune system are systems that are set up to heal automatically. And so if you have a damaged joint, the system says, don't move the joint. I'm going to help you. Tighten up the jaws, then tighten up the neck. If the jaws aren't enough, then tighten up the neck. And if that goes on, then you have tightening of the upper shoulder girdle. So everything gets tight when you have inflammation in the joint. The fourth step is sympathetic drives a scalene muscle contraction. Sympathetic activation causes sustained contraction of the scalene muscles, especially the anterior and medial or middle, to hold the head motionless. I'm just reading from these steps for you if you can't read them. As I said, and then compression of the brachial plexus. The tightened scalene muscles squeeze the brachial plexus as it passes between them, leading to arm, hand, and finger tingling and numbness, sometimes burning and sometimes pain. Amazing phenomenon. I mean, I was stunned when I put those pieces together. I didn't invent anything. I am just had broad training enough with both a dental degree, medical degree, a degree in cell biology and anatomy, a couple years with the NIH doing research on facial growth and development, that I wasn't intimidated not to look and to be able to put these dots together, these pieces together in the puzzle that explains something that is very obvious and that I was introduced to by listening to my patients, by just listening to my patients, and then being stimulated to look and investigate that particular statement or information. I will repeat now something that just came to mind. I'll repeat it. I've mentioned it many times on my podcast. I put it in my blogs a couple times. I've stated it in several independent interviews when I'm interviewed on other people's podcasts. But if you have a problem that you do not have a solution for, that doesn't seem to have a solution for the problem you're trying to solve, then my contention is you're either asking the wrong question or you're asking the wrong source or person. And there's nothing wrong with asking a patient about their symptoms and having them talk about those symptoms. And it can bring to mind a lot of information or a lot of ideas or concepts that will lead the doctor to try to help that patient. Doesn't happen every day, that's for sure, but it does happen, it can happen, and here's an example of that happened to me and allowed me to help more patients by identifying this symptom and maybe avoiding some carpal tunnel surgery. And actually, with the urbanic device and protocol, we basically totally can avoid temporomandibular joint surgery. That's another topic, and why I believe that, why I can prove that, no matter what kind of damage is done to the temporomandibular joint due to chronic inflammation. I mean, there are things that go on with the temporomandibular joint that definitely need surgery. A totally dislocated joint would need surgery. If you have ankylosis of the joint, you're going to need some joint surgery. But if you have chronic inflammation and good old vanilla TMD, no matter what the x-ray looks like, I can tell you that that joint does not need surgery. What that joint needs is to be unloaded long enough to allow the chronic inflammation to go away, and in this case, allow one of the disparate symptoms, which is arm, hand, finger tingling, and numbness, to dissipate and go away. With that said, I think I brought this to a good conclusion. I appreciate your attention. I appreciate you being here. I hope my remarks and my investigation and my podcast and this particular episode help you understand this problem, which is a huge problem, which is being misdiagnosed, mistreated, misdirected millions of times throughout any year in the United States of America and worldwide. I don't fully understand why it took so long to get here. I honestly don't. There are very smart people who have tried to attack this problem, investigate this problem. Very, very smart people. But what I see and I describe is that currently everyone who is attempting to treat this problem is just treating symptoms, whether it be through dry needling and Botox and medications and drugs, talk therapy, trying to get people to decrease their anxiety. Anxiety is related to bruxism, no doubt about it. That's all we can say about bruxism. We do not understand the mechanism of bruxism. We know it's within the brain stem. We know the mechanism. There is a mechanism there that creates anxiety, worry into bruxism. It's actually biblical. I looked up and got I believe, a list of 7 biblical quotes that brought clenching and grinding of the teeth, mentioned clenching and grinding of the teeth in the Bible. It goes back a long way, but you can't talk somebody out of their anxiety. Everybody has anxiety to some degree or another. There are ways to decrease your anxiety for sure, and I wish those of you who have it or are bothered severely by it find better ways, good ways to release your anxiety. But the only thing we know about bruxism that we can say with fact is that there is a relationship to anxiety. The more anxiety, the more worry, the more concern, the more people tend to brux. But talking somebody into, getting rid of all their anxiety is not going to happen. But there are doctors out there who will try and claim that for the treatment of their TMD. That's just one example. So I'm trying to demystify TMD, to bring the common sense into it, to bring the facts into it, brings into the science into it, the basic sciences, in this case, anatomy, physiology, nerve anatomy, the physiology of and the brainstem. That is well documented. I didn't make this stuff up. I just took a few courses in it. I've been familiar with it for 50 years. All right. I've gone on long enough. I hope it's meaningful. I hope that you'll return next week. I record these on a Tuesday morning, every Tuesday morning. Today's morning is July 14th, 2026. I hope you meet me back here on the 21st of July. I am Tony Urbanik, and this is TMD Demystified.